Hi, this is Dr. Amy Zheng again. This is part 2 of our Being Heart Healthy talk. In part 1, just a little recap, we talked a bit about heart disease and stroke, what are some of the signs and symptoms, what causes them, and how to treat them. And remember, the key was that you have to get them into my ER soon so that we can start working on them and getting them to treatment. Now, after part 1, you may be wondering, okay, this sounds really scary, and what can I do to help decrease some of my risk of heart problems? So this is what part 2 is about. We're going to learn about what can you do to minimize your risk. And then we're going to switch gears a little bit and talk about how to perform CPR, because with bad heart attacks, people can sometimes pass out, and you may end up needing to do CPR, and you can help save a life that way. So for this part of the talk, it's important to have your weight and your height. You get bonus points if you know the weight and height of your family members, because we're going to calculate a body mass index. And then I want you to get a sturdy couch cushion, okay? And then we're going to practice doing CPR on it. So what are the risk factors for heart disease and stroke? Diabetes, obesity, smoking, physical inactivity, and an unhealthy diet. All right. So being a couch potato is a complete disaster and a setup for getting heart disease and stroke. And being in a quarantine really doesn't help, right? Because it's really hard for us to move around a little more than we used to. At least back then when you were in class, you had to walk in between classes. You're not walking in between classes anymore. So we're going to talk a bit about physical activity. And we also know that obesity is on the rise for children, right? And diabetes, we usually used to see it only in adults. Type 2 diabetes, not so much. We're seeing them in kids now. And all of these can stem from physical inactivity and a poor, unhealthy diet. Okay, they are all connected. And we're going to talk through each one of these. All right, so what is diabetes? If you think of diabetes as having a lot of keys laying around, but none of them open the lock that you want, is kind of what happens. So your cells need insulin to use glucose, right? And we know cells need sugar because that's energy. But in order to use that sugar, they need insulin. That's your key. But if you for your life have eaten a lot of sugar, the insulin ends up stop working. Okay, the insulin does not work anymore if you've been using a lot of sugar all your life. And as a result, the insulin doesn't work, the sugar can't get into the cell, and what happens? The cell thinks it's starving, right? So if the cell thinks it's starving, it's going to crave food, it's going to be hungry and thirsty, and it's going to be you're going to be really tired. You're going to have to pee a lot. And the reason for this is because the body is trying to get rid of all this excess sugar that it can't use. And remember back in science class, you might have learned about osmosis, right? The water will rush to where there's a lot of solutes. So if it wants to get rid of sugar, the sugar is going to get peed out along with water. And all of that sugar will also damage nerves in your hands and feet where the small nerves are. And so you're going to end up getting tingling and numbness. All right, so let's take a little look at this video that talks about
90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating.
Okay, so again, if you have any of those symptoms where you feel like you need to urinate a lot, you're really thirsty, you are tired, you're hungry all the time, you have tingling in your hands and feet, come see us. We can help you out. Okay, so that's diabetes. Obesity. All right, so we actually have a scientific way of defining obesity. It's not just looking at somebody and saying you're fat. Okay, it has to do with how tall someone is too, right? Because someone who's taller than someone like me, and I'm only 5 foot, they're going to be able to carry a lot more weight than I do. So what I want you to do at this point is to Google CDC Child BMI Calculator. Okay, and you're going to plug in the numbers for yourself and calculate your BMI. Now, bonus points if you can calculate the BMI for your family members. And if they're adults, they would need the adult BMI calculator. Okay, I have the links here for you. And the cutoff is 25. Okay, anyone with a BMI of greater than or equal to 25 is considered obese. And what does that mean? That means you have an increased risk of stroke and heart attack. And we have to be extra vigilant about trying to get the weight down. Okay, so I'm going to show you what that BMI calculator is. I want you to Google it on your computer. You're going to plug in your age, your gender, your height, your weight, and it'll spit out a number. And also on the left-hand side, there's an adult one, an adult BMI calculator. So go ahead and pause this video so you can do those numbers. Okay. So after you calculate your BMI, and you now know what it sits, whether you're considered obese or not. So the next slide we're going to move on to is smoking. All right. Bottom line, don't do it. I'm going to show you 2 lungs here. This is a lung from a healthy person, not a smoker. And then I'm going to show you a picture on the right here, which is from a smoker. Okay. The picture on the right is cut as if you're slicing through the left, from the left to the right. Okay. The one on the left here is sliced as if you're cutting from head to toe through the nose. And what you see here is the trachea on the right, and it splits into the bronchi, each bronchus on one side, and then they split into smaller sections. Okay, and this is your aorta that pumps blood to the rest of your body. And notice how in the normal lung, the texture of the lung is pretty tight, right? It's pretty uniform. Don't mind the color because sometimes that has to do with the preservation process. But notice that they're nice and tight alveoli here. Look at this picture. You have big holes here. Okay, you should not have holes in your lungs this big, okay? And what happens is with smoking, it's like, you ever try to blow a balloon and you blow it a lot? And that balloon then loses its elasticity and it doesn't go back to its normal size anymore. It stays stretched out. Well, that's what happens to your lungs when you smoke. All right. Again, it stays stretched out because it has lost that ability to kind of go back to its original shape and recoil. notice some of the white stuff here. That's scarring. Okay, that's a lot of junk. It's a lot of scarring that while the body tries to heal all that inflammation. All right, so just don't smoke. There's no need to ever. Physical activity. This is key. All right. This is a chart from the Center for Disease Control looking at how much exercise people in different ages of their life need. All right. And we have a message from Coach K and Coach Shoemaker right now.
Risk of artery damage from high cholesterol, high blood sugar, and high blood pressure that can lead to a heart attack or stroke. There are two different types of exercise you should focus on.
One is aerobic exercise. This exercise gets your heart pumping for an extended period of time. Aerobic exercise improves circulation, which results in lowered blood pressure and heart rate. Brisk walking, running, swimming, cycling, playing tennis, and jumping rope are examples of aerobic activities. The American Heart Association recommends at least 30 minutes 5 days a week for adults and 60 minutes every day for kids.
Another type of exercise is resistance training. This is any physical activity that is designed to improve muscular fitness by exercising a muscle against external resistance. External resistance can be weights, exercise tubing, or your own body weight. Resistance training is important because it has an effect on body composition. For people who are carrying a lot of body fat, including a big belly, which is a risk factor for heart disease, it can help reduce fat and create leaner muscle mass. The American College of Sports Medicine recommends at least 2 non-consecutive days per week of resistance training.
Your daily diet is another factor that contributes to good heart health. Some tips to remember when planning your nutrition include: 1, control your portion size. How much you eat is just as important as what you eat. 2, eat more vegetables and fruit. 3, select whole grains, which are great sources of fiber. And 3, limit saturated and trans fats found in processed foods, dairies, and meat.
Planning your meals in advance is an important step in making good nutritional decisions. It is also important to remember to include some treats every now and then. Moderation is the key.
If you want to learn more on physical activity and nutrition for health, you can click on the links on this slide. They came from a chapter in my son's PE textbook. So keep up the great work learning about the importance of physical activity and nutrition on your health.
All right, so that's a message from your PE coaches about the importance of physical activity. So again, aerobic exercise, meaning you got to get your heart rate up. Okay, that's running, that's soccer, that's jump roping. And then you also need some activities that strengthen your muscles. Okay, and then they will be sending you these 2 documents. I was not able to embed these 2 documents in here. All right, so what is your diet? What do you eat? Okay, and unfortunately, the American diet is very high in saturated fats, not a lot of fiber, not a lot of fruits and vegetables. Okay, and it's up to you to make some of these suggestions sometimes and say, hey, Mom, Dad, can we have vegetables? Are we vegetarian once a week or 1 meal a week? Make small changes. Be gradual about your changes and think about it. Yeah, that donut's really yummy, and yeah, that candy is really good, but do I need to have that now? And have I had it in the last couple of days? You really should not be eating this every day. And the key to a successful, healthy diet is moderation, right? Don't starve yourself of things that you really enjoy, but again, you should not be eating it every day or even every week, okay? High sugar, high fat foods once in a rare while, but stick to the healthy stuff, the things with the colors, okay? The greens, the reds. Be careful of fad diets that cut out whole food groups. There's very little research that says you can cut out whole food groups. And I would consider meat as an occasional food the way that you would consider cookies. And remember, you can't unwind the clock. And a lot of times when patients come to me in the ER and I have to give them the bad news that they've had a heart attack or a stroke, first thing they're going to do is go, oh, I wish I hadn't smoked for so long. I wish I had eaten better. I wish I had been more healthy. And life is a marathon. It's not a sprint. You can make these changes throughout your life and not end up in my ER when you're 40 or 50 years old. Alrighty. So we're going to switch gears a little bit. We're going to talk about CPR now and sudden cardiac arrest. Okay. So what exactly happens in cardiac arrest? Well, remember, going back to the heart is a pump, and the pump can sometimes stop moving. And what causes that pump to stop moving? It could be because there is no electrical signal to tell it to pump. There is a big heart attack, okay, and the cells have died, so it can't pump. And globally, it's a bigger killer than all of these diseases combined, and that is colon cancer, breast cancer, prostate cancer, the flu, pneumonia, car accidents, HIV, firearms, house fires. You put them all together and they still are going to be less than the number of cardiac arrests that happen every year around the globe. Okay, that's a huge statistic. We pay attention to the cardiac arrest that happens outside of hospitals. That's 350,000 a year. Interestingly, 70% of them actually happen in your house. Okay, so again, really important because that means that there may be somebody around who can help them out. But sadly, only 46% of the people that have a cardiac arrest get CPR from a bystander. Okay, that's less than half. And we know that CPR saves lives. That's been well documented. All right, so traditional CPR, what happens? You find somebody who's down, they're not responding, you tap, you shout, hey, and I usually like to say, what's your name? Because then they have to say something. If you say, are you okay? They may grunt a little bit or twitch a little bit, and sometimes it's hard to figure out exactly what's going on. But you shout at them and shout at them loud because older people sometimes have hearing problems. You ask for help. You call 911. You ask someone to get a defibrillator, AED, an automatic external defibrillator. You're going to look and see if they're breathing, okay, or if they're only gasping. And you'll know because the chest will be rising if they're breathing. If they're not, you're going to push hard and fast. You're going to give them some chest compressions. Okay, 30 chest compressions, squeeze the chest, and then you're going to tilt the chin back a little bit and you're going to give them 2 breaths. And you repeat that. Then 30 compressions, 2 breaths, 30 compressions, 2 breaths. And you keep doing that until the AED gets here or a paramedic gets here. So we're going to talk a bit about an AED. Okay, that's a defibrillator. All right, so an automatic external defibrillator. It's available in most public spaces. You'll find it in the airport. There's actually one at Grant. Does anyone know where the one at Grant is? Behind a glass box. And it's next to the flag in the auditorium. Okay, so remember that. And what happens is, remember how we talked about how the heart can't pump because it doesn't get an electrical signal? And when that happens, it can't be an effective pump, right? So this is a process called ventricular fibrillation. The ventricle is fibrillating. Okay, so I'm going to show you a video of that. Bear with me for a little bit here. Okay. So your normal heart rhythm, your heart pumps, right? It squeezes. But in ventricular fibrillation, it does this quivering business. So it's not an effect, it's kind of moving, but it's not moving effectively so that it's pumping blood throughout your body. Now you give it an electrical shock and you can actually shock it into a normal rhythm. Okay. So remember that EKG I showed you earlier in the last part? Well, if you were to put an EKG, do an EKG on somebody with ventricular fibrillation, you would see this kind of squiggly line. All right, again, it's just doing this quivering business. So how does an AED work? It's actually very simple. And all you have to do is follow directions on this thing. So I'll show you how it works.
To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient.
This is the part where they're trying to see if there is ventricular
Shock
fibrillation.
advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Okay, so pretty simple. Just follow the instructions. That's it. All right, so going back to traditional CPR, the trouble with traditional CPR is that the research has shown that people really don't want to do this. The mouth-to-mouth portion makes people really hesitant, especially if it's a stranger. And so people worry about not being able to do it right. They worry about getting germs or some diseases from a stranger if you're gonna do CPR. So what the American Heart Association did was they developed this thing called hands-only CPR. And it's only 2 steps and it's very easy to remember. The key though is for this 2-step CPR, it has to be for teens and adults only. Okay, I'm gonna say that again, teens and adults only. So what's the age cutoff? 8 years and under. 8 years and under, they still get mouth to mouth. Okay, you can't just do compressions on kids. The reason being that when kids collapse, it's mostly because of lung problems. Whereas when adults collapse, it's mostly because of heart problems. And when you collapse with a heart problem, your lungs are still full of air, still full of oxygen. So you can use that to circulate and use that for a little bit until help arrives. Once the paramedics get there, then we have ways of delivering oxygen to unconscious people. But the thing you need to remember is that 8 years and under, the kids still need mouth to mouth. All right, so let's see how hands-only CPR works.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more.
Okay, so again, 2 steps. Call 911, and get your hand on the patient and start CPR. Remember, this is only for teens and adults, not kids. Kids usually have lung problems, and that's why they collapse. So you need to give them that oxygenation. All right, so this is kind of an interesting statistic. After the American Heart Association rolled out compression-only CPR, what they found was that people were much more willing to perform CPR, right? That's great. Well, the next question is it as effective? Because it wouldn't be good to introduce a concept that people are willing to do if it doesn't work. So here's one study that uses 2011 to 2017 data. If you don't do CPR, the chances of you surviving for the next 30 days, okay, is 7%. It's pretty abysmal, right? If you do the standard CPR where you give mouth to mouth and you compress the chest, it goes up to 16%. If you do compression only and no mouth to mouth, it's 14%. So the conclusion is, yes, standard CPR is still better, but compression only CPR increases your chances of survival at least twice. Some studies would actually say 3 times, depending on the one you look at. So it's better than no CPR at all. And if you can get lots of people doing this, you're going to save many more lives than a few people doing standard CPR. Okay. So really important concept here. So how do you do CPR? Well, it depends on who you're doing it for. For an adult, you need 2 hands. For a child, and a child is defined as 1 to 8, ages 1 to 8. It's 1 hand right in the middle of the chest. An infant, which is, let's say 1-year-old or under, you use 2 fingers and you push straight down, okay? 30 chest compressions and 2 breaths, or a rate of 100 per minute. And the key is making sure that the chest rises, all right? So what happens? What happens in the heart when you do CPR? So when you push down, the heart sits between the breastbone and the spine, and the heart gets squished. And so that is the squeezing portion of the heart, and it squeezes blood to your brain, to your arms and legs. When you let go, when you come up in between the compression, the heart fills. And what happens is when people are really excited, they're really nervous about doing CPR, they'll keep pushing on the chest without ever letting it come right back up. And it's really important that you have that right back up so the heart can fill. Otherwise, you're just squeezing and squeezing and squeezing with no filling. And that is not going to get you oxygen to the brain or to the legs and arms. Okay, so you want to go down about 2 inches. Okay, you don't have to be exact. Just remember about 1/3 of the chest. And yes, you can crack ribs. You can puncture a lung. Okay, there are risks to doing CPR. But remember, the downside to not doing CPR is only 7% of people survive to 30 days, which means 93% chance of not surviving. And that is death. 93% chance of death versus some cracked ribs and a punctured lung. I can fix cracked ribs and punctured lung. I can't fix death. Okay, so we're going to demonstrate CPR here. All right, so this is Grandma Annie, and Grandma Annie has collapsed on the floor.
Uh-oh. Hey, hey, what's your name?
No answer.
Okay, I gotta check the pulse now. Oh, there's no pulse. Hey, can you get an AED and call 911? Sure.
And he's also going to look at the chest and make sure the chest is not rising.
I gotta go.
So lock your hands, and hands are in between the nipples, right on the breastbone, to the rate of 100 to 120 beats per minute.
All right, I called an ambulance, and there's no defibrillator around. Uh-oh.
Are you feeling fatigued yet?
No.
Are you doing good compressions? So 1/3 of the way down. okay, or 2 inches. Make sure you recoil. You have really good recoil right now, so the chest can bounce back. And you're doing it to the beat of...
Can we switch? Yeah, sure.
Okay. Recoil. This is the perfect rhythm. And you do this until when? Until 911 comes, or
They die.
they wake up. Okay. Hopefully by then the ambulance will arrive. All right, great job. Okay, so notice that when they were switching, there was really not a lot of hands-off time. Okay, you go right into that chest compression because that is still supplying blood. Every second that you're not doing CPR is no blood flow to the brain. So it doesn't matter if we can get your heart working again. If your brain is deprived of oxygen, you're not going to do very well. All right, so this is the part where I want you to practice with your couch cushion. All right, so we're going to review all the steps. Get your couch cushion ready, put it on the floor. Okay, you're going to practice asking someone to call 911, or if you have your cell phone on you, get it out and pretend to call 911. Don't do it this time, but in a real life situation, you would. And if you're out in the public space, you ask to get an AED or a defibrillator. You're going to briefly check for breathing, see if there's any chest rise, and then check for a pulse on their neck, kind of like how your PE coaches have taught you. You find the trachea in the middle, you slide your finger off to the side. You can even, in fact, check it on yourself. Slide it off to the side of the trachea right before you hit the muscles. You should feel some pulses. Okay, but don't waste a lot of time looking for pulses. Okay, just start CPR if you're concerned. If the patient is awake or if they're doing well at all, they'll tell you to stop when you start pounding on their chest. Okay, you want to go 2 inches deep or about 1/3 of the depth of the chest. And probably about half of the depth of the cushion, depending on how thick your cushion is. You can get your music ready if you want to use this link. You can use Staying Alive by the Bee Gees or another one, Bites the Dust by Queen. Those are all at 100 to 120 beats per minute. And as you're doing your CPR, make sure that you're letting it go, come back up, meaning, and for the chest to recoil in between pushes so that the heart can fill with blood. And the studies have shown that after about 2 minutes, people will start getting tired. And that's when you want to ask a family member to switch with you, okay? And that switch time has got to be seamless because you don't want that brain to get no oxygen at all for the time that you're switching. It should be right one after the other. And you only stop CPR when the ambulance arrives or if the patient wakes up and tells you to stop. You can also try to feel for a pulse, but I can tell you that's really difficult when you're in the middle of doing CPR. Okay. All right, so in summary, I want you to be physically active and eat healthily, okay? Because those are really the only thing that's gonna prevent heart disease and stroke, as well as not smoking and not doing drugs. And remember how I had you calculate your BMI and your family's BMI? Okay, if anyone has a BMI that's 25 or more, I want you to do as homework, make a plan, talk to them about how to lower their risk for heart disease and stroke. You know, what are you gonna do and how are you gonna attack this? You know, maybe it's eating vegetarian meals once a week. Maybe it's adding fruits in your diet. Maybe it's going out to eat fast food less. Maybe it's getting up and going for walks, a brisk walk. And then when you do CPR, remember the first step is always getting help and getting an AED. And then you're gonna do CPR, you're gonna do it continuously and making sure that the chest is allowed to recoil and fill with blood. But in kids who are 8 years or younger, you have to do mouth to mouth. Okay, the mouth to mouth portion is eliminated for adults and teens. And lastly, you know, don't be afraid to perform CPR. When I was a resident, I kind of like an apprentice doctor, I was said to my master one day that I was really afraid of doing CPR because I was afraid I would get it wrong. And he looked at me and he said, you know, the chances of them surviving without CPR, and this was about 15, 20 years ago, he said, the chances of them surviving is only 3% if you don't do CPR. So by you doing CPR, you are already doubling or tripling their survival rate. So with those numbers, you can't go wrong. All right, so I hope you practice. I'm going to go back to this slide here so you can practice some more, practice with your family, and practice at least once a year, because we forget. We forget these skills. And even as doctors, we have to take a class every 2 years to remember how to do this and remember all the steps.